I'm going to get this. Perfect. Let's get this into our screen here. All right, so hopefully I'm seeing Joy here. So thumbs up if you can see this okay. Everybody can see that, great, awesome. So welcome everybody, and thank you for the date change for us. Probably better than having it right during our Thanksgiving kind of end of the week. So, and thanks to the new people that are joining us. We're excited to have you, and we're excited to share a little bit of the information about the work that we're doing, but also some of the work nationally and how we're aligning with those things. And we are always welcoming more partners to engage in this work and join us. So I will keep going here. So today what we're going to do is we kind of have a little bit of a heavy agenda. So we'll see if we can get through it all. It seems like we don't, because we have really great discussions. But we are going to start us off with Joy. She's going to give a little bit of some national updates that are really exciting. So we're anxious to hear from Joy. Then we're going to get into some project reports, some of the work that we're doing in our CDC grants. And we'll hear from some of the Greg and Deb on some of those things. And then we're going to get into some hub development. And that's why we brought Capital City Fruit Partner in. They're going to share a little bit about what they've been up to and then what we're doing together. And then hopefully we'll have some time to open it up for discussion. But if not, we do have an idea that we would like to engage some of your ideas for the new year. So we'll get to that too before we get out of here. So if that works, Joy, I'm going to go ahead and let you kind of start us off with the exciting news nationally.
Yeah, thanks everybody. It's great to see you. So my name is Joy Dahl. I'm the social care advisor for the Iowa Community Hub. And as Trina and I have been talking, there's so much going on that's really growing and proliferating for community care hubs and also just in the healthcare landscape. So we just want to kind of give you some context and give you an update of where that is and how we're aligning. So, you know, I share this to give like the big picture because really values-based care, which is moving away from fee-for-service to pay-for-quality, is really driving a lot of the efforts around looking at health data and health equity. And so we've evolved from the triple aim, which was focused on population health, to adding the quadruple aim, which addressed the burnout issue even pre-COVID. And then for some reason, COVID opened our eyes to health equity being a really big issue. And so we've added that in the quintuple aim. And these are all concepts that embody where we're seeing like a lot of policy levers that are occurring, which we're going to share a little bit, which is hopeful to improve the health of our communities. Next slide. Oh, okay, there you go. So, yep, hot off the press yesterday. So we've read this as much as we can to be prepared to share with you today. Biden and the Biden administration put out the U.S. playbook to address social determinants of health. And it really emphasizes and addresses that there's going to be lots of federal dollars and policy levers to support community care hubs as really the place where that referral and navigation is going to occur. So if you understand a lot of what's going on in policy recommendations from CMS and from the Joint Commission around health-related social needs, is there are billing codes for screening. But really that referral and that navigation is really intended to come out of health systems and be more in the community. Yet we know community-based organizations are not necessarily mobilized or ready to take on all this data and HIPAA and the services. And so hubs are really going to be the infrastructure that helps them get to that next phase. So there were two big documents that came out yesterday, the playbook, and then also addressing health-related social needs as recommendations. It's interesting, the first recommendation in the playbook is about data sharing and getting more information to really understand the picture. And so this is, again, where the hub can really be a great infrastructure as we build out the IT piece along with the service delivery. So I encourage you, we're going to send these slides out so you can look at these links and dive into these documents. Again, they just came out yesterday. So next slide. And so this is actually in one of the documents as the new proposed conceptual model for hubs. You can note that it is meant to be evolving, but you really see that there's the community navigation piece there, and there's a lot going to be a lot of investment of federal dollars in the community care hub models. They announce in these documents that there will be funding. And then that health IT is a really big piece of it. So how do we connect data and to tell those stories and help providers and help our community members access resources. And so again, this is actually aligns a lot with what we've already built in Iowa, which is really exciting. And also in a lot of the work we've been looking at, a lot of hubs are local or boundary based because they're through an area agency on aging, but Iowa's really unique in that it is a statewide hub. So that allows us to be a neutral convener and collaborate with anyone to data share and connect people with resources statewide. Next slide, please. So what does all this mean as we move into values-based payment? This means that for the patient experience, we're more focused on teamwork, cross-sector teams, shared decision-making with patients. When it comes to population health, we're focused on chronic disease management. And we're seeing the CDC and a lot of these movements recognize that chronic disease and social care need to be interconnected, that if someone has a food insecurity, we need to make sure the food they're receiving doesn't exacerbate their chronic disease. Data is going to be used to tell the stories around what populations need and where resources are going to be allocated. And so we need to collect and share those stories. And this is going to allow us to get paid in new innovative ways through value-based care and alternative payment models, more support for prevention than sick care. And we're going to show you how the hub is actually already getting into some of this work. And then another big focus of the hub is on reducing clinician burden. So if you know anything about primary care, I think all the requirements would elicit like a 25-hour primary care visit. It's just insane what's put on providers. And so hubs really can take that off by saying, hey, if you think a patient has a need, make a referral, we will handle the rest. And then you still get the data and the story around what happened with that patient so that you're understanding their story, but not having to be responsible for all elements of their care. And then there's new evolving around Tequity, which is looking at also how do we build technology that supports equity and also is formatted in ways that empower people and provide them the health information they need, rather than, there are patients that have 25 patient portals and their data is all over the place. So again, trying to centralize and look at those opportunities to democratize data in protected, respectful ways. Next slide. So how is the hub doing this? So we started, we were actually approached by the CDC and the National Association for Chronic Disease Directors to look at implementing an innovative payment model. This is in discussion, and the current partners are the hub, Iowa Department of Health and Human Services, and Iowa Total Care. If you have interest, please put in the chat. We would love to talk to you or get you involved. This is, again, looking at how we're going to move into values-based payments and really develop contracting with payers to support some of these services, to support individuals. Again, this is around the National Diabetes Prevention Program, but there's a huge opportunity, and everything that came out yesterday indicates this is the direction we're going. So we're happy to take questions on this. Again, it's preliminary, we're exploring, but we're really excited to be approached to see how the hub can start doing this work. Next slide. And then just, so if you're aware, CMS is also putting out, they said they were going to pay for social care and what that looks like. And they actually just put out, I think last week, there's going to be new codes and billing codes around health-related social needs screening and navigation. But again, that also opens up for contracting with payers to receive these services. So if we can send you the links if you want to look at these regulations, but it's coming out of Medicare. It's hospital-based right now. But really what you're seeing is that community health integration services, which is exactly what the hub does. We are working to, prepare and do more of that risk assessment. And then the principal illness navigation services, the hub already offers navigation. We have a health IT infrastructure to take referrals. And then we're working as a neutral partner to connect to organizations that, solicit referrals. So examples would be Unite Us and Find Help, HIE, and to connect all the partners to be able to not put additional burden by our health partners to say, hey, if you don't work with this tech vendor, you can't work with the hub. So a lot of work is going in around that. And again, we're really mobilizing for this. The reimbursement and the codes start in January. Will health systems be ready and mobilized? Probably not, because the codes just came out and it takes a while for things to get into electronic health records and for clinical workflows to change. But the story here is that the hub is ready for this work. So we'll be reaching out to health partners to make them aware of how the hub can help and be a support. So I think that's my last slide. We're excited by all this national movement. We are, again, mobilizing and building capacity to be ready for all these policy levers. And so, again, we'd love to have you help and participate. And if you need more information, please put it in the chat. We're happy to. I might pop some of these links in while Greg talks, just if Trina, people want to get access to some of these documents.
Yeah, I think that was great, Joy. I know that it's a lot of stuff coming at you here, but also I'm sure you have also been getting all this through your emails and trying, just like us, trying to get on as many webinars to learn as quickly as possible. We appreciate that our national partners have approached us in some of this testing or preliminary type work. So we're excited about that. And like Joy mentioned, we have engaged a couple of our partners already to check their interest, and they're interested to come to the table to talk a little bit more. So if anybody else is, we're kind of looking for some healthcare partners, some providers to join us. We have our payer, of course, we have our state health department, and then who else would be interested? Would love to see aging, to join us as well. So excited of the work that's coming for 2024, and we'll get a chance also to hear from you about some of your ideas for 2024 as well. But I wanted to open up right now to anybody that might have any discussion points, questions, or anything they want to share.
Hey, Trina, this is Tiffany at the PCA. So I will just offline, I'm going to connect you with Allison Moses, who introduced herself earlier, because value-based care payment is something that we do a lot at the Iowa PCA, and social drivers of health is also a huge part of the work that we're doing. So I think that there's definitely some major intersections there. So I'd love to keep that conversation going. And one other thing that I would just add to this discussion, which is super exciting from a behavioral health perspective, is that CMS is also putting out new guidance and coding for additional provider types to be able to provide mental health and behavioral health services, because historically Medicare has only been open to social workers. And so different behavioral health provider types will also be able to now bill Medicaid and work within FQHCs, which is super exciting. And the other part of it too is that there are what are called health and behavior intervention codes, which are behavioral health codes that are tied to a medical diagnosis, such as someone living with diabetes that is struggling with anxiety, so their diabetes is not well managed. Those codes have historically only been open to psychologists, but they are now opening those up to the broad behavioral health provider world. And so I think that there's a lot of really exciting things happening with how behavioral health can also be from an integrated health lens. So love to have further discussion on that around the behavioral health piece, but just wanted to add that in, that it's super exciting that there's going to be more opening up for those integrated health pieces.
Excellent, Tiffany. That's really exciting, and that means we could probably work even more closely together on some things. Yes. So we're excited about that.
Yeah, Trina, I was just going to say, like, one of the things that's also really exciting about the diabetes, to Tiffany's point, is we're seeing a lot more effort to recognize combination. Like, you don't just have one thing, right? And so the National Diabetes Prevention Program, I'm subject matter expert on one of the strategies. They're starting with diabetes as the like kind of linchpin of figuring out how to kind of connect. But the goal is that they would figure out and support chronic disease management for all kinds of chronic disease, recognizing how they exacerbate, which obviously behavioral health, chronic disease management. So I'm thrilled because those of us have been in healthcare know people don't have just one thing going on, but yet this is what fee for service does. It silos the care, and values-based and population health drives us to really actually look at people holistically. So awesome. All right, sorry, I see Greg has his hand up.
Oh, no worries. Great.
I was just going to add, I'm not sure, Trina, if everyone is aware of the NIH R01 grant that we just submitted in October. So we have these meetings only every other month, but the hub infrastructure and partnerships enabled us to be to quickly rally and get a grant in for an R01 call that was specific for equity in healthcare. And so it fit perfectly with what some of the things Joy was alluding to of shared decision making, reducing the burden on healthcare by doing the referrals, using the Gravity project. So I just thought I'd let everyone know that another grant is in review, and it's synergistic with all the things that we're doing here. And if if we don't hit on the first review, we'll be able to be competitive on a revision. So that's another grant. And we can send out a brief update or a abstract of that, Trina, if that's of interest to everybody.
Yeah, I certainly can include it with the meeting notes for sure.
Sure.
And Tiffany, this goes back to you. We have brought in the IPCA, Iowa PCA, and primary health care with that. So we're excited those works together. Anybody else? All right, well, we'll keep going. Great discussions, and really nice to see that everybody's excited about this. And it's hopefully going to bring some great initiatives and partners together in the new year. All right, Greg, I'm going to go ahead and turn it over to you for some reports.
Great. Yeah, this is an update on our CDC state arthritis grant. And this shows the different teams, and we've shared different versions of this team structure. But one thing we wanted to highlight here for the Hub Advisory Board is these teams actually could develop and the capabilities and serve the broader goals of the Hub. For example, referral source, connector team, marketing team on the left. Those are all teams that we need for all different innovations and partnerships through the Hub. We also have a delivery team that's going to help facilitate delivery of evidence-based programs into practice. This specific team is focusing on ABIEs, which are arthritis-appropriate evidence-based interventions, and that's what our state grant is about. And we also have an evaluation team. So all of these teams could grow. We'd welcome broader input on them, but we've gotten off to a good start on the grant and had individual team meetings with all these groups led by these team leaders. And we've also had various leadership team meetings. We just got back from the CDC, had a required meeting for all states that were funded on this. And so that was a 2-day meeting. And we are funded as a component A state. And there's 6 states that were given that, or, that receive that, and 6 states that are component B that are kind of following through on the second phase. They've been funded before and they're on their second phase. But I think even after the meeting, we realized, and others told us, that our state is we're almost ahead of the game and almost operating like a component B state in terms of function, because we have partnerships and clinical referrals. So that shows that we're in good stead, and our state model is being well recognized across the country. So what we wanted to do, since we only meet every other month, and we also have meetings in between these months with the Translational Research Committee, where some of this gets discussed, is we're going to have brief kind of share outs from some of the team leaders. And so in the future, we'd like different other team leaders to share, but today we're going to have brief updates from the ABI coordination team, and I'll give an overview of that since Abby Caniglio is away today. And the other delivery team is led by kind of ISU Extension, and Dawn Dunnigan leads that, but she's away as well. So Deb Sellers will lead that. So we're going to have brief updates from these 2 teams, and then in the future, alternate and cycle with what other teams are doing. So next slide. So as far as the Abby team update, again, it's kind of funny that Abby team is led by Abby, spelled differently. But every time I say Abby, her mind perks up, because when you hear your name called, you're always like, what? So she has to recognize that her name is being called all the time. But the goal of these ABIEs are to facilitate coordinated delivery and training of arthritis-appropriate evidence-based interventions in community settings. And so the 3 primary ABIEs that we targeted are Walk with Ease, CDS&P, or Better Choices, Better Health, and also Tai Chi for arthritis. But there's 10 or 12 different ABIEs, and we're agnostic and would love to have broad support and training on all of them, depending on where there's interest, capabilities, training, and those types of resources. So I outlined a couple priorities that are right in our grant proposal. So these are specific action plans. 1.1.3 is to increase the capacity of CBOs to deliver group or hybrid Walk with Ease. And I'll highlight a little bit of how we're doing that right now, because it harmonizes with what the delivery team is also doing. So we'll be training organizations on Walk with Ease and providing free training and support. So I'll show a little bit about that. And we'd love and welcome any help from all of you to refer other CBOs or groups that are interested in that training. So we're ramping up right now. We're also working on a landscape analysis of ABIEs across the state. And a landscape analysis, if you Google it and try to really look into what it is, it really refers more to not just where they are geographically, but what are the barriers and facilitators of drawing people into them, And so we'll be conducting kind of a systematic statewide survey. My sentence didn't finish here, but the survey will be coming out in January. And we're going to want any and all help from all of you to facilitate broad distribution. We sort of view the goal of the survey is almost to draw attention to the hub. So we would want to reach as many extension agents, as many AAAs, as many organizations across the state as we can to find out what they're doing, what they're interested in. And if they're interested in training, then we want them to opt into the hub for more communication. So we sort of view it as a time to bring more people to the fold here. So I'm going to leave it there, and maybe Deb, you can take a similar dive into the delivery team.
Sure. Thanks so much. Can you hear me, Greg?
Yep.
All right. I appreciate that. I'm in my car and my connection's been a little bit sensitive. So just jump in here if something happens, Greg, and let me know. But I'm excited to be here with you today. Deb Sellers, Associate Dean for Academic Personnel in the College of Human Sciences at Iowa State University, and also an Extension State Specialist. And we have so much enthusiasm and fun things going on around the delivery team. We're excited to be able to share with you just as we're getting started, right? This is our launch, but we've got some things to be able to share with you. One of which is that at the moment, we have more than 15 professionals who are interested in training and delivering the Walk with Ease program. And that includes not only our extension and outreach staff across the state, but also Milestones AAA has jumped into the fray, as well as the Halcyon House, which is Wesley Life community in Washington County. And Dawn, who leads the delivery team, and also Abby, the person, have been meeting and coordinating so that once we begin that process, we know what the second steps need to be for our community partners out there across the state and are ready to direct them to what they need to do. Of course, in order to get those 15 people, we've been doing some promotion across the state. And that includes within Extension, but we've also had some radio spots that Dawn has been able to procure and take part in. Additional partners that we have that we've been talking to include the Iowa Heart Foundation and Happy at Home Consulting as well. So again, beginning to really think about who are all those partners out there across the state that both need to know what we're doing and then have an interest in joining us. We do have a delivery team meeting on November 28th already set up. And we'll be inviting more individuals to join us to attend the training and the follow-up webinar for Walk with Ease. Trina's going to give us a brief hub tutorial in that meeting because we certainly want our community partners to feel confident about using the hub. And then one of the other things we'll be doing, just overlapping with what Greg is talking about, is saying, hey, community partners, if you're already doing some of these Abbeys out there across the state, let's get you into the hub, let's capture those numbers, and let's be part of this statewide initiative. The delivery team will be setting additional meetings in order for us to be able to continue our work. And then just a few other points, and then I'll let you move on to the rest of the meeting here. But Dawn just completed the chronic disease self-management course and the Healthy Heart Ambassador program, both of which are Abbey deliverables. So, great to have our leaders really understanding what's involved with the training and being able to go out there and deliver as well. And one of the other things that we're looking at is we are pretty sure we've been able to recruit an extension staff member who has a lot of connections with the military community and with veterans in particular. So we're interested in pulling that thread and seeing where it goes. And I'm happy to take any questions.
Yeah, let's open it up now to anybody if you have any questions for Greg and Deb and the work that we're doing with the arthritis grant.
Greg and Deb, Greg, I got to hear you speak at the Diabetes Wellness Summit as well, and really coming from a hospital setting to an outpatient setting, really thinking about our patients and their falls and arthritis and the patients we see come back into the hospital. Is there any connection with patients who are discharging from a hospital to have referrals in that outpatient setting as you guys are looking to get more people into this program?
Yeah, thanks for that question. We're actually doing that very idea locally with our Story County Fall Coalition. So we have a meeting coming up at the end of the month and the 29th, and we'll be pulling in like the emergency room team and others. And so they actually put a band on patients that come in that might have a fall risk, and then they kind of know these individuals need some additional care when they're leaving. So even after, or in inpatient or ER visits, we're going to try to piggyback that off and provide a referral for fall screening, like similar to what I covered at the meeting or at the fall symposium, or referrals into Abbeys. So yeah, we're going to capitalize on kind of the inpatient communication there as well. So, yeah.
And then I would just add just a little bit with that, with the Iowa Falls Prevention Coalition being a part of this work. We're tying that to our action plan of the Iowa Falls Coalition, and that is a very strong or high priority for the Iowa Falls Prevention Coalition to create those links with hospital for discharge to the community. So lots of layers there.
Great, thank you. I love that.
Anybody else? All right, excellent. Well, thank you so much, Greg and Deb. Those were great reports. Hopefully we'll see the other teams that come together in future meetings give such great reports, because you guys are super thorough. So thank you so much. Greg,
I can cover this really quickly, Trina, since I know we have to move on. But I thought I'd share also how these two teams harmonize together. So in our action plans and our logic model for the grant, it directly specifies how the delivery organizations on the top will build capacity, just like Deb said, and the Abbeys will provide statewide management of these Abbeys and support through training. But collectively, the two goals are, the two teams harmonize together to increase availability and accessibility of Abbeys. And so we'll be doing that right now, and I'll give a brief example of how we do that how we're rolling that out with Walk With Ease. But again, that's just one evidence-based program, and we'll be doing that similar model with more. So click next slide, please. So as we put this together, one thing we paused and wanted to make sure that the groups interested in Walk With Ease had a full understanding of the different formats. So Walk With Ease is available in group, self-directed, or hybrid formats. And so we wanted to brand the hub, the extension, and explain how it works, and let these groups decide ahead of time, are they interested in helping on the hybrid or group, or just referring into the self-directed program. So next slide. Another benefit of our hub affiliation is we already cover the portal. So this is developed by the Osteoarthritis Action Alliance, and it's a very powerful tool that makes it easy to deliver Walk With Ease. So I highlighted 3 bullet points that the portal provides benefits to organizations that are delivering Walk With Ease. And again, we're paying for this already, and we can provide training in how to use it. So it benefits the organizations directly. It also benefits the participants. So it's free for participants that enroll through our hub. And so the second set of bullets, it gives participants weekly newsletters, video training, goal setting strategies. All of this is built into the portal, and it harmonizes directly with Walk With Ease. But the key part is that it also gives an integrated system for the hub to track all of this. And so all of the people that are engaging in Walk With Ease training, we need that engagement to happen through the portal, because the portal directly links to Workshop Wizard, which is what the hub uses to track our data. And that'll allow us to have outcomes on the number, the reach, the efficacy of our programming, and many other indicators that'll all come into Workshop Wizard. So that's an example. So next slide. So as Deb said, we've got a number of organizations that are already interested, and we're sort of going to ask them in the next month or so to clarify their interest about what type of programming they want to lead. We'll launch this in January with training through the Arthritis Foundation, and we're providing free training. So it's an $89 online training, but we're providing each group with a code that allows that to be free. But then we're providing supplemental training on how to do it in the real world. Like, how do we really roll out Walk With Ease? Because there's a lot of challenges of operationalizing those things, and things we've learned along the way in delivering Walk With Ease that we can impart on others. So anyway, the supplemental support is provided by the hub and our Walk With Ease team. And that's just an example of one set of training. I actually have to leave to go teach here in a minute, but there's a slide at the end that Trina will cover on various other forms of training that we're offering, including fall screening and other things. So I'll leave it there, Trina.
That's great, Greg. Thank you. Anybody have any questions about training? And like Greg said, this is a great example. It's with Walk with Ease, but it's what we imagine to be doing for the other types of Abbeys and other programming that we support to create this kind of training infrastructure. All right. Well, thank you again to Deb and Greg for your presentations. Thank you. All right, so I'm going to actually stop sharing my screen so that we are able to get to our partners at Capital City Fruit to provide a little bit of information about them, what they're doing, all the great things they're doing in Iowa and beyond, and then that'll tie into what we're doing together or what we want to do together here in the near future here. So Mike, yeah, you're ready to go.
All right, thanks, Trina. Good morning, everybody. It's a real pleasure to be with you today and included in these conversations. A little bit about me. I've been with Capital City Fruit for approximately 10 years in total as a produce buyer and a food service account executive. And now I work up with our econ team, our special projects in Produce RX, Food as Medicine, and other strategic partnerships as they arise. And prior to Capital City Fruit, I was in pharmaceutical sales in Central Iowa, representing medicines used to treat or prevent diabetes, heart disease, and blood clots. So this new role has been a really great fit for me from my perspective. Thank you to the Iowa Community Hub for asking us to share a little bit about Capital City Fruit and what we do. We've realized and embraced we are a non-traditional partner in healthcare, and we are very happy that Iowa Community Hub and others also understand and embrace the post-COVID response to the Food as Medicine movement. Even though we've been around for 75 years, some of you may be saying, who is Capital City Fruit? And that's probably because we've always delivered to grocery store chains like Heidi and Fairway, C-store chains like Casey's, and restaurant wholesale suppliers like Sysco and US Foods. But about 4 years ago, we started selling fruit gift baskets on Amazon. And then just before COVID hit, we started our own online produce aisle. And so now you can go online to Amazon or our website, capitalcityfruit.com, and shop our online produce store for delivery directly to your home or office. And we can typically get produce into the hands of consumers 3 to 5 days faster and fresher than most brick and mortar stores. So produce can last longer and can be consumed with peak nutritional value. We deliver preset packs, a la carte items, workplace wellness options, and personal or corporate gifting options directly to homes in the metro, across Iowa, and across the United States, locally on our van or with shipping partners like FedEx, Speedy, and UPS across the country. Did my screen move?
It did not.
Okay, we'll try it again.
There we go.
We are also known in the community for our work with the USDA and charitable organizations, and we partner with the USDA on 3 programs. The Farmers to Families Food Box Program, which we delivered tens of thousands of produce boxes to needy families across Iowa during COVID. The Emergency Food Assistance Program, or TFAP, it's a federal program that helps supplement the diets of people with low income by providing them with emergency food assistance at no cost. And then we also work with a partner to deliver food on the food distribution program for Indian reservations. It's an income eligible households living on Indian reservations get USDA foods. And we're working to accept SNAP and EBT payments to serve many others in need. DMARC, as you see on here, is a liaison with 12 pantries in our area, and we work with the Food Bank of Iowa to help with pantries in 55 Iowa counties. Hunger Free Dallas County has come to us to supply produce for community fridges located in Dallas County libraries. And Eat Greater Des Moines is a food rescue partner that does great work distributing perfectly good food that might otherwise end up in a landfill, say after a conference or something. And we currently fulfill privately funded produce boxes for pantries, food banks in Nebraska. And additionally, at Capital City Fruit, we have an employee take-home program to help feed our employees. And produce in our system that is unfit for human consumption is collected in our facility and delivered to local farmers to feed livestock. So we have nearly zero produce going to landfills. We source directly from a vast network of local U.S. and offshore growers to find the freshest in-season produce daily. And we follow the growing regions and seasons, allowing us to provide our customers with the freshest high-quality produce year-round. And to ensure a constant stream of fresh produce, we rely on some outside third-party logistics companies and our own growing fleet of over-the-road semi-trucks to get fresh produce to our facility. We have shipped hundreds of thousands of custom orders of produce and pantry boxes over the past few years from our facility in Norwalk. And we also offer a workplace wellness program where we deliver fresh fruit to offices around Iowa and beyond. And we have a variety of options to suit any type of businesses so that clients can offer healthier options to their employees. And I'm not trying to make this a commercial, but if you don't have this, you should. It's a great program. We have a network of produce experts across the country that allow us to deliver fresh produce quickly from Seattle to Key West. And we're providing food as medicine solutions in these areas. We work with nutritionists and dietitians to customize exact solutions for diabetes, heart disease, obesity, and more. And we're also working to address the social determinants of health that others have brought up today, specifically food and nutrition insecurity. Our home service delivery virtually eliminates healthy food access barriers, and there seems to be a groundswell of support and demand for more funding at many levels for these solutions. And so here's a representation of the great organizations we've had the good fortune to work with over the past couple of years. I want to highlight a few today. That's the Iowa Healthiest State Initiative, Mom's Meals, the Iowa Food System Coalition, and the Iowa Community Hub. With Iowa Healthiest State, we participate in their current and future Produce RX programs with our online ordering and home delivery solutions. And Mom's Meals provides prepared meals for their clients. And they recently started to offer fresh produce and healthy pantry item solutions that Capital City Group fulfills for them nationwide. Most recently, we developed a culturally appropriate produce box for farm workers within the Proteus network. And of course, the Iowa Community Hub is including us in grant proposals as a partner organization, fulfilling produce boxes with home delivery for individuals participating in chronic disease prevention and management programs. They're quickly being looked at as the hub to help coordinate food with participation in health programs for organizations without the infrastructure, staff, or other means for managing food. And Trina can speak to how they are setting up screening food, nutrition insecurity, food ordering, and tracking outcomes. We kind of already talked a little bit about today, but I'm sure we'll get into more of that. And so if you would like to learn more about us, I'd like to invite your teams to come to Capital City Fruit for a meeting and a tour of our facility so you can see firsthand what we do and how we do it and how our solutions may fit within your initiatives. And we look forward to uncovering other fruitful opportunities together.
I love that, Mike. Thank you. Thank you so much for this presentation, and very excited to share with all of our partners this great work that you guys do. And we're excited for the partnership that we have with you and what we know we can do, which I'll speak to in just a moment. But before I do that, I'd love to open it up for anybody that might have any questions directly for Mike and their work specifically.
Well, that's great, guys. My email's up here. If you have any questions, be sure to reach out. We'd love to hear from you.
All right. And I'll go ahead then and
stop my sharing.
Yeah, I think I can jump onto mine here.
Okay.
All right, because I'm going to move into, let's see if I can get to this next. There we go. All right, hope everybody can see that okay. So some of the work that we are excited to do with Capital City Fruit, we have an idea for a community food project that we've already have the infrastructure in place. We've been working with Capital City Fruit now for a little while to and our technology platform, and to make this a really easy process. And then we've been talking with providers. We had brought it into a grant early on in the year. One of our partners didn't receive the grant, so But we haven't given up on this idea. And so now we've got this into a lot of different grant options that we've already written and submitted. And then there's more to come. So the idea that we have is kind of, I want to share this in the kind of this workflow so that you guys can see kind of what we're kind of working on to set up for this addressing food and nutrition insecurity, getting used to saying that. So the workflow kind of starts with our partnerships with our healthcare providers. So physicians or nurse practitioners complete the SUA's risk assessment. And now that we've heard from all the things that are happening nationally, more risk assessments, more SUH will be happening. And then if there is a positive for a patient that could really benefit from one of our evidence-based programs that some of our community-based organizations are providing around the state. So if there's a good connection to a program, that healthcare provider can refer to the hub. And also if they detect needs for community resources, addressing some of their health-related social needs as well. So that's a referral that could come to the hub. We have our hub navigators. And right now we've been doing some of this screening ourselves manually with a lot of the questionnaires and surveys that have come very specifically with the programs for those evidence-based programs. But what we have just recently done is work with Prepare and actually the National Association of Community Health Centers, and just got ourselves a license agreement to integrate Prepare into our technology so that on our navigators, when they receive referrals into the hub, they can start with using the Prepare screen or the Prepare screening tool to identify any social determinants of health or social drivers of health, any eligibility checks for evidence-based programs. And then that's a referral then hopefully to the program that they, I'm getting unstable connection. Can you guys hear me okay?
Yes.
Okay. Sorry. So yeah, so then the Hub Navigator uses Prepare Screen, checks eligibility, and then Hub Navigator then enrolls them in the program. And then from there, if the patient is also food and nutrition insecure, the Hub Navigator makes the food box order for monthly home delivery. And Mike, we can talk a little bit about that, but it's about a 10 to 12 pound box of fresh produce. And I don't know, I think you and Adria talked a little bit about that. So I'm not sure if we've decided on some of those boxes and what that looks like.
I think we have. It looks like a great box, it really does. And
Okay.
of course, we'll add any kind of swag or any kind of inserts, recipes, nutrition information, whatever that we all agree would be good to put in there.
Great. So again, the physician screens, sends a referral to the hub. We do a more comprehensive screening with the Prepare tool, check program eligibility, get them enrolled in the program. And the key is the participation in the program. And then once they're participating in the program, we're also addressing their food and nutrition insecurity if that's detected. And then our hub navigators make the order for monthly delivery of 10 to 12 pound boxes of fresh produce to those individuals, to their homes, as long as they're participating in the program. So our whole idea with this is to address food and nutrition insecurity, increase healthy food consumption, and with a national issue with retention in programming, we're hoping that this increases participation in evidence-based interventions like our ABBIES, our Diabetes Prevention Program, and others, so that people can really have the chance to experience the benefits that have been proven with these evidence-based programs. And so as long as they're receiving that, or excuse me, as long as they're participating, they receive the benefit. Then we're also connecting them though to longer term sustainability options for food resources, like connecting them to the local food pantries, double up food bucks and so forth, so that not only while they're participating are they receiving a great resource, but then we're also helping them plan for the future for sustainability. And then with the hub, we will be tracking referrals, demographics, program outcomes, which is what we're set up to do now. And then we're also then looking at collecting data on how much food was delivered through obviously our partnership with Capital City Fruit, self-reported changes and so forth that we can add to some of the data that we'll be collecting, and then sharing this feedback with our referring providers, and also just to help us in planning for programming and or services in the future across the state. So that's a little bit about our goals with this community food project. I think there's a lot of potential with combining evidence-based programs and helping prevent and manage chronic disease with this addressing food and nutrition insecurity. So anybody have any comments at all about that effort that we're working on?
I would just say, Trina, that I've seen a lot of data that suggests that having the food component really helps drive, compliance for meetings and other things for patients. So it's a great addition.
Yes, Mike, and I've also seen some research coming out showing that the key piece of home delivery has really, stepped up the effects of being able to connect people with food resources, but also addressing that home delivery. So addressing that transport access piece has been successful.
Access is huge. Access and funding, I think, is where it all comes down to sometimes.
Yep. So looking at grants, but also in what you heard from Joy earlier with our pilot with NACD, CDC, and our partners on innovative payment models, we know that evidence-based programs aren't readily reimbursed at this time. National Diabetes Prevention Program sure is getting along, but others are not or have had challenges. So one of the efforts of hubs nationally is to look at bundling of packages of services. So this is kind of the start of us looking at that. We would like to bundle an evidence-based program with screening, with food, and possibly looking at some partners that have been interested in adding to that some medication management also. So there's some innovative ideas that we have in potentially finding ways to support evidence-based programs while also addressing social determinants of health. Any comments? All right. Well, looking at the time, I'm going to kind of rush here. And sorry, we are having a little bit of a storm where I am. So I was having some unstable connection, but glad you guys were having no problem hearing me. And that has passed, so hopefully no issues anymore. Really quick look into 2024. We are working on launching our membership services. First phase of this membership is geared for CBOs, providing programs and services, and it's our way of supporting that work through membership. You can look at our website to find, if you go to the membership piece at the top, you can find all the benefits or all the support that comes with membership to support the delivery of evidence-based programs. Things like helping them with compliance, providing a database management system for collection and data, connecting them to the referral network that we're building with the hub, decreasing administrative burden. So partners can really concentrate on the program delivery piece and not have to worry about calling referred individuals a number of times, getting all their intake done or all those post surveys and post data work done. Those are things that we take care of on their behalf, and enrollment and so forth. So we have started to take individuals through this onboarding process into the hub, and it begins with this hub interest form, where they kind of complete this information and they check off all the things that they would need support in, or if they're interested in learning more about. Our hub administrator, Renee, who's here with us today, will then reach out and get them connected to the best level of support through membership. And that looks like this here. So this is kind of what we're kind of building towards. So there's going to be different levels of support, everybody will have access to joining the hub and receiving some level of support, and hopefully it still brings a lot of value to our community-based organizations and others trying to refer into programs. There'll be no barrier to posting your programs. There's no barrier to referring to programs, and there's full access to a lot of program management resources and disability resources. So that will be available to everyone. But then if there's other supports needed, then we'll look at different levels of support. Currently, there is no charge for any of this work, and we're onboarding individuals into these levels to help us customize it and make sure that we're meeting all the needs. And even in 2024, when we officially launch this, we do not want the amount of membership, the cost of membership to be a barrier. So it's going to be extremely reasonable. It's just going to be just enough to cover a little bit of administration costs. But it's also going to be some buy-in into this, and they will be accessing a lot of support, and hopefully we'll start to see a lot more programming being sustained in Iowa. This also opens up more opportunities for contracting, hopefully with sustainable funding for the future for our CBOs. So like I mentioned in this membership support, we're going to have the responsibility on the hub side to elevate the compliance of HIPAA, data security and governance. We're going to have HIPAA trainings for all of our CBOs. And so hopefully, again, that will be opening up their opportunity for more funding. So that's one of our priorities. And lastly, just about done here is just the training opportunity. So you heard from Greg earlier. We're looking at doing that with other program training, but then also professional development. So as a member, you'll have access to a lot of these trainings for free, if not all trainings for free, but Walk with Ease, we heard from, and then there's a lot of different organizations and entities that will be engaging to help coordinate these trainings, fall prevention screening, motivational interviewing. We know that Telegen provides the DPP training in the States. We'll be working and coordinating with them and hopefully aligning CME credits with all this as well for individuals. So I'll go ahead and stop my screen and sharing here, but I know that's, again, a lot coming at everybody. I think hopefully there's a lot of exciting things to look forward to in 2024 through our partnerships, through the work that we can do together for creating sustainability. Angie, I'm seeing you in my picture here because we've talked about that whole braiding and blending of funding and how important that is. And so hopefully some of these efforts can start bringing in the contracting and the other opportunities for funding for these programs and for this work. So I'm going to leave it at that. I know we only have a couple of minutes. Does anybody have any questions or comments or anything to share at the group?
This is Angie. Thanks, Trina. Just a quick update. We, HHS, in particular, my team just received an AmeriCorps grant, and that will be working on all the AmeriCorps members will be trained as community health workers under our HRSA grant. And the other focus beyond community navigation is food insecurity and helping individuals mitigate those risks. So if you know anybody who would be interested in being a host site that would all have trained community health workers, just please reach out to me and we will set up a time to talk.
Excellent.
Thank you.
Absolutely. Anybody else? All right. Well, Joy and I have plans to send out a survey to our group, our Hub Advisory group, to see what you're interested in 2024, gather your thoughts, priorities, and want a chance for you to share that and how you can, work with the Hub or want to work with the Hub, or, even with your own, without connecting with the Hub, we want to be able to share and network and make sure everybody's in the know of all the good work that's happening around Iowa. So we'll send out a survey to the Hub Advisory here soon and try to get some feedback about what are the important things for 2024 for us and for partners to be thinking about and working towards. So, okay, that's just a little heads up. All right, well, thank you, everybody. Happy holidays. and be safe, and we'll see you in January.
Thank you, Trina. Have a great
Thanks,
day.
Trina. Happy holidays.